Check for respiratory symptoms such as a cough and runny nose. Since coronavirus is a respiratory infection, a cough, with or without mucus, and a runny nose are the most common symptoms. However, these could also be symptoms of allergies or a different respiratory infection, so try not to worry. Call your doctor if you think your illness might be caused by coronavirus. Consider if you've been around someone who was sick. If so, you're more likely to have contracted an illness. Do your best to avoid being around people who have decreased immune systems. Notice if you have a sore throat along with your cough. Coronavirus also causes sore throat, so this can be a sign of an infection. Typically, sore throat appears early in a coronavirus infection and isn't caused by frequent coughing, so consider when your sore throat began to see if it might be caused by coronavirus. You may be able to soothe your sore throat with a hot tea or throat lozenges. Rest if you're having a headache, body aches, or general fatigue. Similar to other respiratory infections, coronavirus may cause a headache, body aches, and fatigue. Generally, you just won't feel well. These symptoms could be a sign of coronavirus if you also have other respiratory illness symptoms. Your doctor will have to determine which virus could be causing your symptoms. While it could be coronavirus, you may have a different type of infection, such as the common cold or the flu. Take your temperature to see if you have a fever. Since fever is a common symptom of coronavirus, always check your temperature if you're worried you contracted the virus. A fever over 100.4 degrees Fahrenheit, 38.0 degrees Celsius, could be a sign that you have coronavirus or another infection. 6. If you have a fever, call your doctor to discuss your symptoms. If you have a fever, you're likely contagious, so avoid contact with other people. Get medical care if you have breathing problems or shortness of breath. Coronavirus can cause trouble breathing, which is always a serious symptom. Contact your doctor immediately or get emergency medical care if you're having difficulty breathing. You may have a serious infection, such as coronavirus. You may need additional treatments for breathing problems, so always consult your doctor for shortness of breath. Call your doctor if you suspect you have coronavirus. Tell your doctor that you're having symptoms and ask if you need to come in for an exam. Your doctor may recommend you stay home and rest. However, they could ask you to come in for lab testing to confirm your infection. Follow your doctor's instructions so you can recover and are less likely to spread the infection. Keep in mind that there's no medication for coronavirus, so your doctor can't prescribe you a treatment. Undergo a lab test for coronavirus if your doctor recommends it. Your doctor may do a nasal swab of your mucus or a blood test to check for an infection. This will help them rule out other infections and possibly confirm coronavirus. Allow the doctor to take a nasal swab or blood draw so they can make a proper diagnosis. Getting a nasal swab or blood draw shouldn't hurt, but you may experience some discomfort. Get emergency medical treatment if you have shortness of breath. Try not to worry, but a serious coronavirus infection can cause complications, such as pneumonia. If you're having trouble breathing, go to your doctor, an urgent care center, or an emergency room immediately. If you're alone, call for help so you arrive safely. Breathing problems could be a sign that you're having complications, and your doctor can help you get the treatment you need to recover. Stay home so you won't risk infecting others. You're likely contagious, so don't leave your home while you're feeling ill. Make yourself comfortable at home while you recover from your illness. Additionally, tell people that you're sick so they won't visit. If you go to the doctor, wear a face mask to prevent spreading the virus. Check with your doctor to find out when it's safe for you to return to your normal routine. You may be contagious for up to 10 days. Rest so your body can recover. The best thing you can do for yourself is to rest and relax while your body fights the infection. Lie down on your bed or your couch with your upper body propped up on pillows. Additionally, keep a blanket with you in case you get cold. Raising your upper body will help you avoid coughing fits. If you don't have enough pillows, use folded blankets or towels to prop yourself up. Take over-the-counter pain and fever reducers. Coronavirus often causes body aches and fever. Fortunately, an over-the-counter medicine like ibuprofen, Advil, Motrin, naproxen, Aleve, or acetaminophen, Tylenol, will help. Check with your doctor to make sure it's safe for you to take an over-the-counter pain reliever. Then, take your medication as directed on the label. Do not give aspirin to children or teens under 18, since it can cause a potentially fatal condition called Reye's syndrome. Don't take more medication than the label says is safe. Use a humidifier to soothe your throat and airways. You'll likely have a sore throat and mucus drainage, and a humidifier can help. The mist from the humidifier will moisten your throat and airways, which can relieve your sore throat. Additionally, the moisture will help thin out your mucus. Follow the directions on your humidifier to use it safely. Wash your humidifier thoroughly with soap and water between uses so you don't accidentally get mildew in it. Consume lots of fluids to help your body heal. Fluids help your body fight off the infection and thin out your mucus. Drink water, hot water, or tea to help keep you hydrated. Additionally, eat broth-based soups to increase your fluid intake. Warm fluids are your best bet and may also help soothe your sore throat. Try hot water or tea with a squeeze of lemon and a spoonful of honey.